Join me, Aunty on Heal TV whilst we discuss health conditions, their causes, management, and prevention for a healthy living. You know your health is your wealth. Stay connected, stay informed on your health. Only on Heal TV. Heal TV, proclaiming Jesus Christ in good health.
Stay Healthy with Aunty Nurse shows on Sundays at 4 p.m. and repeat on Mondays at 9 a.m. on Hill TV, a multi-TV channel, Hill TV proclaiming Jesus Christ.
Join me, Aunty on Heal TV whilst we discuss health conditions, their causes, management, and prevention for a healthy living. You know your health is your wealth. Stay connected, stay informed on your health. Only on Heal TV. Heal TV, proclaiming Jesus Christ in good health.
Stay Healthy with Aunty Nurse shows on Sundays at 4 p.m. and repeat on Mondays at 9 a.m. on Hill TV, a multi-TV channel, Hill TV proclaiming Jesus Christ.
Good evening, viewers across the globe. Thank you for joining the show, Stay Healthy with Aunty Ness. Stay tuned. Join me, Aunty on Heal TV whilst we discuss health conditions, their causes, management, and prevention for a healthy living. You know your health is your wealth. Stay connected, stay informed on your health. Only on Heal TV. Heal TV, proclaiming Jesus Christ in good health.
Stay Healthy with Aunty Nurse shows on Sundays at 4 p.m. and repeat on Mondays at 9 a.m. on Hill TV, a multi-TV channel, Hill TV proclaiming.
Viewers across the globe. Today we are discussing cervical cancer. Cervical cancer. So we will start by talking about the anatomy of the cervix. Where exactly can we locate the cervix? So the cervix is located in the lower abdomen of the woman. The lower abdomen. The uterus, the fallopian tubes, then we go to the cervix before the outer part, the vaginal. It is the mouth of the uterus. The cervix is the mouth of the uterus. So when you look at the diagram, the number 5 is where the vagina is, the canal of the vagina. 4 is the mouth of the cervix. Number 4 is the mouth of the cervix. Number 6 is the body of the cervix. Then the number 3 is the internal mouth of the cervix. So 4 enters the vaginal. And then 3 is into the womb itself. So on the diagram, we see number 1, which is the ovaries. We have 2 ovaries. 2 ovaries at the mouth of the fallopian tubes, which are equally 2. So we have the left tube, fallopian tube, and then we have the right fallopian tube. And the ovary is what contains the eggs. So instead, woman releases eggs every month for menstruation to take place. That is where it comes from, where the arrow marks 1. And it has the same thing on the other side. Okay, so that is the cervix. So cervical cancer, why do we say cervical cancer? We are more interested in cervical cancer because it is a global concern. It is a cancer that kills women, though preventable. When detected very early, it can be treated and the woman will not have to go suffer cancer, cervical cancer. So like any other part of the body or any other organ, the cervix has tissues which grow normally. It grows normally and then steadily. But where the tissues grow abnormally, to the extent that they infiltrate other tissues surrounding tissues, and it forms a sore, a lump, or a rash. And the sore may cover the rest of the cervix. In that instance, we say that the woman has cervical cancer. So how big is the problem? The problem is very, very big. That's why nations across the globe are creating awareness among citizens so that the women can know and get themselves checked so that be detected early. Globally, across the world, in 2020, about 600,000 new cases of cervical cancer were diagnosed. And out of these 600,000, 80% come from what we call low-income countries, like developing countries, like we say. So the 80% is about 420,000 in developing countries, and Ghana is not left out. And we have 340,000 women dying every year from cervical cancer. So that is how huge the problem is globally. And when you come to Ghana, it is the second leading cause of cancer deaths among women. Second leading cause of cancer deaths. It is sad because it shouldn't happen. It is preventable when picked up early, like I said. It is estimated that in a year, 2,797 women are diagnosed with the disease. And over 1,000, like 1,699 die from it. That's a data from 2021. So you can imagine the magnitude of the problem. So one will say, so what is the cause of cervical cancer? What actually is the cause? The cause is a virus called the human papilloma virus, HPV for short. This virus is located at the genital organs of both the men and women. The genital organs, around the penis, the scrotum, and around the vagina. That is where they are deposited. And during sexual intercourse, women pick it up, and then they get infected during sex. The main cause. But the good news to some extent is that most women are able to fight the disease. Their immune system, about 80% of women have their system fighting it out. So they don't graduate to become cancerous. But some percentage are not able to fight it out. So this one develops. And then it forms what we call dysplasia, precancerous cells. Precancerous cells at the mouth of the cervix. So if it's not detected early, then it may develop into cancer and then later kill the woman. The precancerous cells have no signs. If you talk about signs and symptoms, they do not have signs. Cervical cancer takes about 10 to 15 years to blow out from the infectious stage, the precancerous stage to the cancerous stage. The period within it's between 10 to 15 years. That's how come, and it comes without symptoms. That's how come a lot of women or those who are diagnosed get to the hospital late, because they get to see the signs of cancer before they go to the hospital. So the dysplasia is the small lumps or rashes that form at the tip or the mouth of the cervix, around the cervix. If you see the normal cervix, it looks like what is projected on the screen. It is a normal cervix, so there is no pre-cancerous cells around it. That's how it looks. So like I said earlier on, how does the woman get it? It's mainly through sexual contact. All forms of sexual activity. It could be rubbing genitals on genitals, maybe rubbing your hand and genitals. So you pick it from during sex. And another form of picking it is those non-sexual contacts, like enema. We call something enema. And I can just say bentua osa. Osa. So you see that in some, especially rural areas, they even commercialize the activity of enema. Within the house, probably you have a sexually active teenager. You use the same syringe to pick whatever you want to give enema. Then from her to a younger person, like that. So it spreads through those things. It can also spread through wearing undergarments, wearing somebody's pants or undies. You can also get it through that. But the main cause is during sexual contact. So what are the risk factors? Who are those who are prone to cervical cancer? Those who are prone to getting the infection are those who have multiple sexual partners, because we said earlier on that it is gotten mainly through sexual intercourse. So if you have more than 1, 2, 3 partners, you can imagine the load of virus, HPV virus that you are taking in. You have 3 sexual partners. They also have other sexual partners. So the cycle goes on. Sex at an early age, like less than 20 years. If a young girl has sex earlier than 20 years, she may end up getting exposed, because when you take 10 to 15 years, you will be like 30, 35 years before the full-blown cancer will come. Smoking predisposes one to cervical cancer. Smoking lowers your immunity. So if you get any of them, you have HPV, you end up in cervical cancer. And then those who are immunosuppressed, like HIV patients, those who are, their body itself is low on immunity, they cannot fight diseases. So when they get the HPV, it tends to graduate to cervical cancer. Others also have family history. If you have a family history of cervical cancer, you must be alert and get yourself checked periodically, so that it can be picked early and treated, so that you don't go to full-blown cervical cancer. So like I said earlier on, what are the symptoms? The symptoms in pre-cancer stage, you don't feel any symptoms. The sore, you could even get a sore there, the body will heal it without you knowing. The rash, it is when it goes into cervical cancer that you start seeing those symptoms. So what are the symptoms of the cervical cancer itself? So abnormal bleeding. You bleed, vaginal bleeding, either during sex or in between periods. You are menstruated, you are done with your menses, but before you get to the next menses, you start bleeding in between. That is something you must check. And also pain in your lower abdomen. You are feeling pain, a woman, you feel pain, severe pain in your lower abdomen, you have to check. You have pain when you are urinating. You have to note that. And then you have pain during sexual intercourse. If you have pain during sexual intercourse, it's also a symptom or sign of cervical cancer. When you have smelly vaginal discharge, if you see this is odor, bad odor from your discharging, it has very bad odor, you must be mindful and get it checked. So basically, these are the signs and symptoms of cervical cancer. One will say, how do we prevent it? How? Is there any way to prevent it? Reason for this show is to create the awareness so that you can steady yourself and pick up the symptoms early or get yourself screened. So you go to the hospital, they do HPV testing, DNA test. So they test your blood and check to see if you have the HPV, human papilloma virus. Every 5 to 10 years, you do it to check when you are 30 years old. You also do pap smear. It is very necessary that 25 going, that's pap smear every 3 years, so that the abnormal cells can be picked at their early stages, treated, so that you don't suffer cervical cancer. We have something we call VIA, visual inspection under acetic acid or with iodine. So this one, when you go to the hospital for your screening, they will pass a device under you, visualize the cervix, then they will paint it with the acetic acid, which is vinegar. Then the cells, if they are abnormal cells, it will distinguish itself. Provider sees that these are abnormal cells. Then through that, you can take a sample with a small brush, take a sample. That's why you say add smear. You either smear it on a glass, add some chemicals, and then detect whether they are really precancer or cancer. Or they'll use to get it demarcated very well at the cervix. So that would stop. If it's normal, it will come normal. That is it. And then we have a mobile colposcopy. It's like a device. It's like a mobile phone, but it has some camera on it. So the healthcare provider pushes through your female reproductive organ and visualize the cells to see which are abnormal, and then they can take the treatment from there. Okay, so let's go for a commercial break, and we'll come back later and continue. Thank you. Join me, Aunty Ness, on Heal TV whilst we discuss health conditions, their causes, management, and prevention for a healthy living. You know your health is your wealth. Stay connected, stay informed on your health. Only on Heal TV. Heal TV, proclaiming Jesus Christ in good health.
Stay Healthy with Aunty Nurse shows on Sundays at 4 p.m. and repeat on Mondays at 9 a.m. on Hill TV, a multi-TV channel, Hill TV proclaiming Jesus Christ.
Join me, Aunty Ness, on Heal TV whilst we discuss health conditions, their causes, management and prevention for a healthy living. You know your health is your wealth. Stay connected, stay informed on your health. Only on Heal TV. Heal TV, proclaiming Jesus Christ in good health.
Stay Healthy with Aunty Nurse shows on Sundays at 4 p.m. and repeat on Mondays at 9 a.m. on Hill TV, a multi-TV channel, Hill TV proclaiming Jesus Christ.
Hello there! Yehovah Bookshop and Spiritual Center stocks a variety of Christian literature and spiritual items such as Bibles, devotional guides, olive oil, myrrh, frankincense, Jordan water, prayer mantle, communion wine, and several others from the Holy Land of Israel. We are open on Tuesday, Fridays, Saturdays, and Sundays from 8 a.m. to 7 p.m. Locate the Yehovah Bookshop and Spiritual Center at 15 Green Hill Street, Dome, within the same premises of the Prophetic Hill Chapel. Or call 0244 737836. Delivery services are equally available to any part of the country and beyond, all at a fee. Yehovah Bookshop and Spiritual Center, your one-stop shop for every spiritual item.
Join me, Aunty Ness, on Heal TV whilst we discuss health conditions, their causes, management and prevention for a healthy living. You know your health is your wealth. Stay connected, stay informed on your health. Only on Heal TV. Heal TV, proclaiming Jesus Christ in good health.
Stay Healthy with Aunty Nurse shows on Sundays at 4 p.m. and repeat on Mondays at 9 a.m. on Hill TV, a multi-TV channel, Hill TV proclaiming Jesus Christ.
Join me, Aunty Ness, on Heal TV whilst we discuss health conditions, their causes, management, and prevention for a healthy living. You know your health is your wealth. Stay connected, stay informed on your health. Only on Heal TV. Heal TV, proclaiming Jesus Christ in good health.
Stay Healthy with Aunty Nurse shows on Sunday.
Welcome back. Thank you for staying put with us. We are talking about cervical cancer. And then we talked about the screening methods. We talked about HPV DNA testing. We talked about pap smear. We talked about visual inspection under acetic acid or iodine. Yes. So what happens if a woman tests positive for high risk HPV, which causes the cancer, the high risk HPV? It is not a death sentence. No, it is not a death sentence. Approximately about 80% of women will have it anyway, will get the HPV, but it clears away within a year or two. By a year and two, it will clear away. But those who are immunosuppressed, those whose immunity are suppressed or is suppressed, they get to clear it gradually. So screening alone is not, stopping cervical cancer. Screening only helps us to detect early signs of, or to pick early the precancerous cells. So when they are picked, and you are positive, they are picked, then they can be treated so that you don't suffer cervical cancer. So those who are screened positives, they are followed up, they are scheduled, then they'll see their healthcare provider, their doctors, their midwives, trained healthcare professionals to get it treated so that they don't get cervical cancer. So what are the treatment options? The precancerous cells can be treated. We call something cryotherapy. Cryotherapy is a use of nitrogen gas to sort of burn off or freeze off the precancerous cells. So it kills them and then they fall off. It falls off later. And then thermal coagulation. Thermal coagulation is the use of heat also to sort of burn off the precancerous cells on the cervix. So the woman goes and gets such treatment, and then she will be educated as to how to handle herself. Because with time, it will take like 3 to 4 weeks for healing to take place. For it to heal. So you'll be advised not to have sex, not to, douche, or put your fingers there till your body is healed. So on the screen, you can see some of the screening methods being used. That's the colposcopy I talked about. That is like a mobile device, a screen. So they push it through the woman, and then they can see they can pick the precancerous cells. When you visualize on the screen, you can see that, these are precancerous cells. Yes, and then you get it treated. So what happens? What happens if it is not picked up early? If you don't go to the hospital early, that means that before you realize, you only go to the hospital when you have full-blown cervical cancer. The next treatment also is excision. They call it loop electrosurgical excision procedure. So the precancerous cells are sort of scraped off with a wire. So that's why they will remove it that way. Or they'll use cone. There is a cold knife. They can scrape it off. And then they can proceed to test it to see if it is cancerous or not. So these are some of the treatment options. So we go to prevention. How do we prevent cervical cancer? The first and foremost is vaccination. We have HPV vaccination. That when you go to any hospital, they can give you a shot. And that starts from the ages between 11 upwards. You can get a shot, HPV vaccine. That will prevent you from getting the infection, getting the precancerous cells in the first place. It stops the individual from getting the infection. Yeah, then we go to modification, lifestyle modification. You check your sexual life. You stop having multiple sexual partners, because we said earlier on that the more partners you have, the more prone you are to HPV, and then virtually ending up. So you check your sexual life. The secondary prevention is, I want to talk about some of the names of the vaccinations. We have Cervarix, we have Gardasil, Gardasil 9, Gardasil 4, depending on the species of the HPV that you have. Your doctor will recommend it. We have Secolin, and then we have Warring Vax. Those are some of the vaccines that are in the system. Yeah. So the secondary prevention is for you to go for screening. You go for your pap smear test, when you are 25 years to 69 or 64, you take your pap smear every 3 years. You go and check so that they can pick it at an early stage before it gets into cancer. Yeah. And then also, when they are picked like that, you are treated. It's treatable. It's a very preventable disease. But what happens is that the awareness is not there that much. So people don't really know the importance of getting themselves checked. Women, get yourself checked every 3 years if you are within the ages of 25 to 64. So from 65 going, then you check every 5 years. Because as I said earlier on, the disease progression is between 10 to 15 years. 10 to 15 years, take a long time. So 3 years, every 3 years you do your pap smear. And when it is picked up, it is treated so that you can get into having cervical cancer. Thank you very much for watching Heal TV, for watching Stay Healthy with Aunty Ness on Heal TV. Heal TV, proclaiming Jesus Christ in a healthy life and environment. Well, it's here for a topic I can see cervical cancer. Yati cervical cancer, eye dien, eye yaribia, echi emma, wase wawudie nano, ena yare ne echi. Ente, sa unya, ebetimi ekum, enti na program ni, ye bom koko. Sa obabi a we di 25 to 64 years, every 3 years, also ko check eye pass me. Hwe se omumbe piki emuawa no entem atriti wa. Yes. You see, DNA di ba. DNA di cervical cancer ba. The di ba ni say uwo boyfriends ni girlfriends bebre. Umbo uhun ban. oni we da kwa me da na echina oni kofia da echina na oni kwabena da we yes na wa expose wo to HPV virus no na virus nso chiwa unhu because ma o sign bia ma o sign no say wa wodi na no kra ye ya kan say etochima empo a unhu just say cancer na ahitiu ho no de obehu say u bleedi ubunsa in between ube bleedi oni ohun ka fo nya enketa ho a ebe ya oya wase ya oya ujunso ya oya you know wase wo ho na wase real. Those are the signs by bedu sa sign not say cancer na children da internet advice about say every 3 years we give 25 to 64 obekọ check ni ya picking in term ni ya treat it is treatable ayade ye hu ni ntema doctors and nurses for no omo be treat se na be ya cervical cancer unko chibi man enku enti prevention na no prevention na say oba ba nya be 11 years go dey be hospital na ya woni can say HPV vaccination wo ti ye wona emma onya infection no ma onya infection start having sex onya infection no and afin so no lifestyle changes yanka say hwe ababo mu ye say on the dada with men anyhow obe advice on mamba so say omo stick to one partner momo ndaha omo yes and they expose themselves to the virus HPV virus and yeah, bentua. Sa. The same bentua sa. Obaba or yes sexually active. Woman sa. Moon treating ye no dia sa ketua no. Esa na omo peke. And by the time obe hit that age, no akonya cervical cancer. And an instrument this share ya say those instruments it is share ya say to betimi ama wanya if not well treated. Nti ebusiafo ene topic cervical cancer ene dia bremo or Heal TV so nyame nhya mo say muni ye ejina next week by this time besan the topic for fraba na educate ye ho na atoto anamon se na be ya ye be sum nyame e wo apondimu ye da mo ase Heal TV proclaiming Jesus Christ in good health. Thank you, viewers, for joining us for today's show. See you next week on Stay Healthy with Aunty Ness. Bye.
Join me, Aunty Ness, on Heal TV whilst we discuss health conditions, their causes, management, and prevention for a healthy living. You know your health is your wealth. Stay connected, stay informed on your health. Only on Heal TV. Heal TV, proclaiming Jesus Christ in good health.
Stay Healthy with Aunty Nurse shows on Sundays at 4 p.m. and repeat on Mondays at 9 a.m. on Hill TV, a multi-TV channel, Hill TV proclaiming Jesus Christ.
Join me, Aunty Ness, on Heal TV whilst we discuss health conditions, their causes, management, and prevention
for a healthy living. You know your health is your wealth. Stay connected, stay informed on your health. Only on Heal TV. Heal TV, proclaiming Jesus Christ in good health.
Stay Healthy with Aunty Nurse shows on Sundays at 4 p.m. and repeat on Mondays at 9 a.m. on Hill TV, a multi-TV channel, Hill TV proclaiming Jesus Christ.